Chapter 31 covers environmental emergencies. To begin talking about exposure to cold. So there's multiple ways that the body will actually lose its heat, inducing hypothermia. First is through conduction, basic direct contact, being in water, sitting on a cold surface. Next is convection, that air and water will carry the heat away from the body. So basically like a wind chill. The wind's coming away, carrying the heat to some other place and replacing it with cold air. Radiation is the heat is basically picked up by the surrounding air. So radiation, convection, kind of close into the same. Evaporation occurs when the body perspires or sweats, and that'll cool the body as well. And respiration, losing the body heat through that hot air you blow off. So just see in the picture kind of gives an illustration of all of those, to where you have respirations, breathing out the hot air, convection, the body heat's lost to the surrounding air, which becomes warmer, so warm comes off you, goes over here, cold air replaces it. Radiation is body heat's lost the atmosphere or to the surrounding objects. So that radiation goes to air and other objects, whereas convection is just air. Evaporation from sweating, and conduction by person sitting on the cold rock. Heat goes to the rock, cold goes to the body. So generalized hypothermia, basically just exposure causes the body to reduce its heat levels. That body is unable to maintain its proper core temperature, that good about 98.6 degrees Fahrenheit, ultimately could lead up to death. So some predisposing factors that can cause hypothermia: injuries, chronic illness or ailments, or the geriatric and pediatric patient. Obviously, subtle exposure can also be due to being drunk. You've got thinned out blood or that. There's other underlying illnesses such as anemia or other chronic ailments. Overdose poisonings, not able to control your respirations and maintain your own heat balance. Trauma, losing blood, the warming fluids of the body. Talk about outdoor resuscitation of cold weather stuff, and that decrease just overall air, just being in cold air overall. The effects of cold temperatures on old folks is immediate. A big thing can happen to some older folks on fixed incomes, not getting much out of their retirement, live in places that may get their heat cut off or live in unheated areas, and they can be susceptible to hypothermia very, very easily. So as winter times, hypothermia is a big chunk of cause in a lot of areas. On the pediatric side, the infants and kids, they've got just a little bit of blood circulating through there. It's harder for them to regulate that body temperature and stay normal. They got just a little bit of body fat, and so they're really prone to hypothermia. The best analogy for little kids is they're a big house with a little itty bitty furnace. So patient assessments for the hypothermic patient. Generally you'll notice shivering, and that's in the early stages. They can have numbness or a slight loss of sensation. They can end up becoming stiff and rigid in their joints from practically near freezing, be drowsy, weak, everything kind of goes along with that. They can be having rapid breathing, just their body's reflex of trying to warm up. They could have a slowed pulse just from metabolism in the body going down, or they could ultimately be apneic. Could have loss of motor coordination, just have those kind of ataxic walks or not able to walk at all. The decreased level of consciousness, they could be completely altered, completely unresponsive, and generally they're going to be cold, and they can have pale cyanotic skin or also some red skin from possibly infections or things of that nature. So talking about passive and active rewarming, of how we get that cold patient warm again. So passive is the least aggressive, so just covering them up, get them out of their cold wet clothes, under a nice warm blanket. turning the heat on is passive rewarming. Active rewarming is getting the clothes off and applying external heat source. So putting those ice packs in pretty much every place the patient sweats. So think about where you sweat the most: in your armpits, your head, your neck, your groin area. That's where you'll put the heat packs. For extreme hypothermia, patient can be pretty much near dead. Their heart rate can end up dropping very, very, very low. So when assessing these patients, make sure you check for a pulse for a good while to assure that they're not still alive. If you don't find a pulse, checking it for at least 30 seconds to see if there is a pulse. If you don't find one, then start CPR. If you do find one, care for them just as you would any other patient. So the theory we go by in EMS is you're not dead until you're warm and dead. With localized cold injuries, most commonly that's the stuff that gets as the furthest away from the body, doesn't have a lot of blood flow. Your fingertips, your ears, your nose, your toes, and then your face. Those areas that you've probably all been susceptible to cold stuff living in West Virginia. So you've probably sensed what gets cold first. So those are the areas that are going to be most susceptible to the hypothermic local cold injuries. So that basically the tissues can freeze and the blood within inside will crystallize. So basically, frost nip stuff, how do you care for that? That's just your early superficial stuff, is remove from the cold and cover, keep it warm. The frostbite stuff is cover and immobilize gently. So a picture of some severe frostbite on some fingers. So patient care for them, get them out of their wet clothes into a nice warm area. Actively rewarm the patient if they're severe hypothermic, put those heat packs in their groins, armpits, and always handle these patients with a lot of care, because where their blood has formed possibly into little crystals, you don't want to bump and prod them and possibly make one of those crystals shift around. So that's why we don't rub those cold parts. So if his fingers are severely frostbitten, you try to rub them and warm them up like we've always thought about, you can basically rub and dislodge a piece of frozen blood, and that can become an emboli, causing a stroke, pulmonary embolism, myocardial infarction, death, doing some bad stuff just from cold fingers. So don't rub cold parts. Either use passive or active rewarming. Active rapid rewarming of frozen parts seldomly is that recommended, because there's a huge chance of permanent injury. But what you do is basically submerge or immerse the entire site. So say if a foot is frozen, you would immerse the entire foot into a bucket of really warm water without being able to touch any sides. So basically it just kind of free floats in really warm water. The water needs to be moved continually, not sitting still, not dormant. So basically circulating water. So kind of just like dunking a foot into a hot tub to warm it up. This would only be done if medical direction tells you to. Because you can imagine on an ambulance, kind of hard to find really warm water in the back of a bus. So seldomly would that ever be done. So now we'll talk about exposure to heat. So the effects of heat on the body. Heat that's needed for temperature maintenance and not lost creates hyperthermia. So an overabundance of heat. If unchecked, this could lead to death. Severe hypothermia will kill people. So everybody talks about having heat stroke and things like that. Those are seldom. So basically, it's heat cramps and heat exhaustion. So with that, you got the moist, pale, normal to cool skin. Heat stroke can have hot, dry, or maybe still moist skin. The big difference of heat stroke and heat exhaustion is generally with heat stroke, there's a change in mental status. So with heat exhaustion, they're still sweating, the body's starting to lose its salts, becoming dehydrated, some maybe electrolyte imbalances, and bringing on painful muscle cramps. Uh, Even super healthy people can develop a form of shock brought about by fluid and salt loss. Generally, this is when the first seasonal heat comes through, people are acclimated to the heat and they get struck with it. Or people who are used to cold climates and suddenly come to warm climate, it takes them a while to acclimate. Like we all know how seasons change, and once we kind of get used to the weather, it's not nearly as bad. So just think about like when winter comes and you got those first 40-degree days and you've been used to 70, 80-degree temperatures, it's awful. But then after a while, 40-degree days in January feel pretty good. Just like when springtime coming around, you start getting those 60-degree days and you want to take your shirt off, run around in your shorts and your underwear, and everything's great. But then in July, if it's 60, you're freezing to death with a hoodie and a jacket on. So sometimes it takes the body a little bit of time to get acclimated to the weather. So patient assessment can generally have muscle cramps, weakness, exhaustion, changes in breathing patterns, a weak pulse, super sweaty, or a slight loss of consciousness. So patient care for the hypothermic patient, obviously get them out of the hot environment, give them some supplemental oxygen, get them in the back of the bus, turn on the air conditioning, get them out of their hot sweaty clothes, just get them relaxed, let them take small drinks of water if they have it. Don't let these people be taking drinks of really sugary stuff like Gatorade, because if they've been really hot and that sugar gets in the body, it can make them very nauseous and maybe induce vomiting. So give some moist towels over those cramped muscles, so kind of a form of passive, slightly active recooling and transport. So the patient with hot skin, whether it's dry or moist, that patient who's super hot, has a fever in July, that's generally heat stroke. So as the sweating continues, progressing from heat exhaustion, still losing salts, still having those cramps, still can be developing shock, and still generally related to all those conditions that cause heat exhaustion, just worsening the symptoms. So with assessment, generally change in breathing patterns, rapid shallow breathing, fast heart rates, generalized weakness, little or no perspiration, so they may not be sweating. It could be so bad where they actually have goosebumps because they're so dry and their body's just going crazy. A change in mental status, whether a complete loss of consciousness or just altered, dilated pupils from that change, and hypoxia, and they can end up developing seizures from the hyperthermia. So to care for them, get them out of the hot environment, remove the wet clothing, and do active recooling. So get those cool packs to the neck, groin, armpits, the places you sweat the most. Give them supplemental oxygen and transport immediately. So now we'll talk about some water-related emergencies. Also a good note is the majority statistically of water-related accidents always involve alcohol. So keep that in mind if this patient has an altered mental status, that it could be because they were drunk before they wrecked their boat. So types water-related accidents from boating, water skiing, windsurfing, jet skiing, scuba diving, tubing, everything you can do on the water, or underneath the water. So patient assessments, always those A, B's, and C's. Checking the airway, there's no obstruction, seeing if they're actually in cardiac arrest, checking for injuries head to toe, and a lot of times they can be hypothermic from having an injury and staying in the water, so they've kind of got that convection going on from being in the cold water. So drowning generally begins as they're struggling to keep afloat. When they start to submerge, they try to take one more deep breath before they go under. So with that, water can enter the airway, followed by coughing and swallowing, and involuntary swallowing of more water. So they can end up aspirating water, or almost just kind of choking on water. Sometimes, though, the patient can go under and not get any water in their lungs. And the reason that happens is there's a reflex spasm of that larynx. So it'll seal the airway. So they'll basically have a bronchospasm and completely constrict off just from a reflex of that body. So A lot of times it can just be the hypoxia. So they go under and they may die because of hypoxia, because they're not breathing, because their airway has constricted down. So just every drowning, if you have drowning patients, doesn't always mean they got lungs full of water. So rescue breathing for the patient. Begin rescue breathing without delay. Because if you actually have to go into water to retrieve a patient, so such as in a pool, most generally you're not going to take equipment in there with you. You're not going to have a back valve mask and your whole jump bag with you. So this may be a point where you only have a pocket mask, or you actually have to do mouth to mouth to do rescue breaths for this patient. Always try to maintain cervical alignment and everything with these if you do suspect any kind of injuries. You may have to ventilate more forcefully due to those bronchospasms of that larynx spasm. So you may have to blow air in a little bit harder. May not be an obstruction. It could just be spasm from that diving reflex. You need to care for those spinal injuries in the water. Don't just take spinal precautions once you get them out. So assume generally that all those unconscious patients who can't tell you if their head or neck hurts has spinal injuries. So assume those cervical immobilization as soon as you can. You may not be able to do the rest of the assessment in the water, of course, because you need to get them out of the area before you're worried about really getting a head to toe thing. So mobilize that cervical spine and get them out. Diving accidents, most of the time that's involving the head and the neck. So they're diving into the shallow end when they shouldn't be. Their head hits the water and their neck bends as it shouldn't. So it can end up involving the head, neck, spine, hands, feet, and basically everything. It could be global multi-system trauma. So basically, emergency care for them is the same care as if somebody fell off a ladder, same kind of trauma. Scuba diving accidents, kind of a rarity. A big worry we'll have to deal with is arterial gas embolisms, and that's just basically from gas bubbles and stuff equalizing out in the body from different pressures below the water. Also injuries is diver holding their breath. So if you could imagine a balloon being under the water, the deeper it goes, the smaller it is. So if you got a diver that's really deep, holding their breath, their lungs are full, as they come up, their lungs will actually expand and expand, and they can pop a lung if they are inexperienced divers. So most of the time those diving injuries will be due to inexperienced divers. There's decompression sickness. Basically the divers resurface too quick, and that can take anywhere from a few minutes or an hour up to a couple days later for that to appear. They can have an air embolism, so they can have a PE, blurred vision, chest pains, numbness and tingling, just overall weakness, frothy sputum in the mouth or nose, convulsions, rapid loss of unconsciousness, respiratory arrest, a numerous amount of things. So if anybody tells you that they went diving, now they just don't feel right, could be the issue. Most of the time divers, when you take dive training, they pound this kind of stuff in your head. So they'll probably be pretty cognitive that they've got a diving injury. With decompression sickness, personality changes, general fatigue, deep pain in the muscles and joints, or also known as the bends, from bending, the pains in the joints, mottling skin, numbness, paralysis, choking, coughing, labored breathing, a bunch of crazy stuff going on with the circulatory and breathing issues. They may act like they are completely intoxicated, having chest pains, ultimate unconsciousness. So basically, same general care. It may just be information you have to relay to medical command to know where to take these patients. Generally, diving injuries need to go to hyperbaric chambers, so which may mean that they're put on a helicopter and flown a very long ways away. There are very few places in rural areas that deal with this. Along the coast and big places who do have a lot of diving injuries and stuff may be a place where they have to go. So basically, Same thing, A, B's, and C's, supportive care, assist ventilations, treat as you need to, and always consult with medical command. And keeping them warm, because if it is a rapid onset, same things as cold water injuries, get them warm, prevent shock, and continue to monitor on the way to the hospital. If you do have to go in or you're dealing with an emergent rescue of a patient, there's a saying we use: reach, throw, row, and go. So order of operations you'll do to try to fix somebody. So reach, have an object trying to reach for the patient to grab. So that may mean you get a long rope, or I'm sorry, a long stick or limb trying to have them to grab for something. Throwing something, you may have a rope or something you can throw out to them for them to hold for you to pull them in. Row means you get on the boat, you go for them, or go is the ultimate very last resort where you put yourself in the water and swim to them. If you do not have training to do any of this, I recommend to never ever deal with anything else besides the reach and the throw. And if you do have to operate near a body of water, wear some kind of flotation device. If you don't have a flotation device, call somebody who does, like a technical rescue team. So the little picture of the reaching. So reach out with a great big stick, pull them in, throw and tow, throw out that rope, let them catch it and pull them in, or row, get in a boat and go get them. With ice rescues, a little bit different than those simple water things. Number one rule, protect yourself. Throwing or tossing a rope again, same way you did with the water stuff, is a good way to be able to get somebody out of the ice. If they've fallen through the ice, probably not a good idea for you to go out on the ice with them. If you got a boat, you can have something distribute the weight. You can push it out something wide to distribute the weight instead of just walk on your own 2 feet. But generally, don't ever do that unless you actually have the rescue training. The big thing is you're going to be involved in the treatment of it. So treating that patient for hypothermia, get more help the best you can. Those kind of rescues take a lot of people to get done. Always transport them. Convince them, if they want to sign off, convince them to go get checked out. I'll talk about some more environmental stuff of bites and stings. So first, insect bites and stings. All spiders are venomous, whether it's actually enough venom in there to actually do anything to you or just causes irritation. Generally, insect stings and bites, rarely dangerous. A lot of places don't really have that many venomous things, such as in our area. You got the brown recluse spider and the black widow, nothing too crazy. They're kind of rare instances. A big thing you're worrying about is anaphylactic shock. If they're stung by something, like it'd be trying to get that stinger out as fast as possible. Don't squeeze it out like you're squeezing a tube of toothpaste. Take something hard like a plastic card such as your license or a credit card and scrape that against the skin and it'll kind of flake the stinger out. If you squeeze on a stinger, you will squeeze all the venom in even faster. So a picture of a brown recluse spider bite. You see kind of the general redness and everything there. So that's just an infection, and those are very nasty things. So always checking that mental status, seeing if there's any noticeable changes, checking out the anatomy, doing a good head to toe assessment, checking for where the sting or bite occurred on the skin, and checking it out really good to see if the skin's blotchy, if they have any pain to the area or any itching or numbness, if there's swelling, blistering, weakness, or kind of a swelling or indentation, or if they start to develop any kind of difficulty in breathing. Checking chills, fever, basically good head to toe stuff, asking lots of questions, documenting everything, looking for everything, and seeing ultimately if they're in anaphylaxis. So if they're in anaphylaxis, treating for shock, because they're going to have low blood pressure, a high heart rate from the anaphylactic reaction going on, so their vessels dilate, those bronchioles constrict, difficulty in breathing, hypotension, pale, cool, diaphoretic. So treat them for shock, get them warm, get them covered up, call medical direction, and give them a EpiPen if they are in anaphylactic shock. Most of the time they won't be, but get that stinger or remove venom sacs. Asking all the good questions of like what were they exposed to, what was it that bit you or stung you, do you know? And good rule of thumb, don't take the snake or the bee or the spider to the ER with you. If need be, take a picture of it with your smart device and take that. Don't take critters into the ER. If there is swelling and stuff going on, get jewelry and stuff off in case the swelling starts to go slow. Because sometimes you get them signs may be subtle, then all of a sudden, bam, they start swelling up really fast. So any kind of thing cause swelling, get their rings and jewelry off so you don't lose a finger because they couldn't get their wedding band off. And keep that limb immobilized. So with snake bites, very special care, generally not life-threatening. Generally death is not sudden unless they have anaphylactic reactions to them. Unless you're in some of those crazy desert countries that got those super bad snakes that can kill you with just a really small bite. But those are very, very rare cases. So you stay calm, you keep the patient calm, bandage and immobilize the limb of wherever it was that they got stung. So that way it's not moving, circulating the blood any faster. So then just checking out where the bite was. It could be pure nothing's more than just a slight discoloration. With snake bite, you're not always going to see just the 2 fang marks in like you see in the movies and stuff. They can have pain and swelling in that area. It could be slow, or it could, after 30 minutes, couple hours, then start to develop symptoms with that. They can have a rapid pulse, irregular pulses, labor breathing, generalized weakness, vision problems, nausea, vomiting, seizures, a whole category of a bunch of different things. They can have developing heart dysrhythmias. Most of the time, these patients that got bit by a snake, they go and spend overnight in the hospital just for observation to see if anything starts to happen under a watchful eye. So you can see here in the picture, redness, looks like a little bit of swelling and bruising, and those typical 2 fang marks. One good thing to do is in this, where you see the redness, take out a pen or your marker and mark where it is and note the time. So then during your transport, if it starts to get more red and go out, you're easily documenting of how fast it's actually spreading. So medical care, consult medical command to possibly see where you need to go. They can coordinate with hospitals, maybe need to go to a hospital because only some hospitals will actually stock anti-venom. So they can probably dictate to you where you need to go. Treat for shock, preventing that loss of body heat. Keep them calm and you stay calm. Locating that mark, trying to see how fast the redness or site is spreading. Getting the jewelry and extremities off in case they do start to swell. And keep the extremities immobilized so that the muscles and everything aren't moving, making it spread even faster. So now we'll talk about some poisoning from marine life. Really crazy, not that common things, but who knows, you may be at the beach someday and somebody gets stung by a jellyfish and you need to jump into action. So it can occur in multiple ways. This could mean that you ate some crazy shellfish that you're not supposed to, or you're on vacation in a third world country and like, here, try eating this, and you eat it and it's a crazy diseased octopus or something you're not supposed to know of. Also stings and punctures, getting stung by jellyfish, stingrays, crazy off the wall stuff. That fresh water can activate toxins on the skin, increasing the pain. So use salt water to rinse the affected area if you get stung by some kind of crazy thing.